skin and all won't be loose because you know why? Because we're going to work on this area and stretch it here.
Okay.
So the skin won't be loose. You have a pen here?
Yeah, but little bit down we can be.
Yeah.
Some people won't just below the ear, but it's okay if we go a little bit below the ear also.
Done.
Yeah, and
see, the one thing is we have to check where the nerve will come.
Okay.
The nerve comes through the bone.
Yeah, actually in a video I just saw that in some different country a patient has undergone some jaw surgery and she had some marginal mandibular nerve damage and her smile was very asymmetrical. So I was
be careful.
Scared. Yeah, I was very scared and my mother said that if anything goes wrong, I will not talk to you for life. So I was very, and she was very serious. She wasn't like this and both my parents they were very against it, but I requested them for 2 years continuously. That's why they have just agreed. Okay,
you need it. You're a doctor. You'll be seeing so many patients.
Yeah. My father even sent me for counseling, that she requires counseling. She doesn't require surgery. It's all in her head and
what's
she doesn't.
What's wrong with him? Where's your dad? Call him.
Yeah, he said that if required, just call me.
Okay, fine. Then not required. You tell me if you have any doubts. These are all the questions.
Yeah.
Looks like an exam paper.
Yeah, this was an exam sheet only.
Okay.
I just carried it because it is lining. So I don't want any fat removal.
We are not doing buccal fat. No.
Yeah. And my question was, like the masseter is like this, the entire zygomatic process to the downwards. So can it be done that only the down portion can be removed, not the entire thing? Because I don't want hollowness.
No, you don't see what happens if you remove the muscle is this long. If I remove the down portion, where will the muscle attach? You're a doctor.
No. Actually, like this. If this is the muscle, so can we give a slant incision so that the upper bulk is more and the bulk in the lower area is.
No, that is correct. But the muscle attaches where?
At the bone.
To the bone.
Yeah.
The muscle length has to be maintained in order to get the muscle to attach to the bone.
Yeah.
So what I do is, the best way is to split the muscle sagittally.
Yeah.
Matlab the muscle is this thick, I remove one part of the muscle like this.
Saying that while splitting, can we do that? The upper leg can be removed. No, the lower fibers can be removed more as compared to the upper.
The lower fibers I will remove only. Upper I won't remove because the fibers that are close to the skin, we will retain it. The ones that are close to the bone, we will remove. That's how I remove when I do the sagittal split osteotomy. Second group of people, we don't remove the muscle at all. But in your case here, this asymmetry is also there. So I'll have to check the width of the muscle, and if it's the same size, I may not do much. If it's I'll have to do that. But so that depends on the actual scenario we're going to have.
So I don't want much muscle removal. Obviously, whatever is required.
Very minimal only. Muscle removal is not going to be more for you.
Because initially I was having very chubby face, and everyone right now is asking what has happened to your face. You look because this portion has gone very much inside. It was like full roundish and squarish. If you see from here, then it would appear square, but otherwise in the front it was kind of roundish. So I don't want much soft tissue to be removed, but the angle thing. And zygoma reduction, can it happen like the front portion is not removed and only the side is protruding? So this can be removed. And the bone will not be weak.
And I won't remove fully because the zygoma, it's only about 8 mm generally. So I'll take about 4 mm. So what happens if I remove 4 mm there, I should remove at least 2 mm here, otherwise there will be a step. So I'll just remove it to get the shape.
And what about the skin over here?
Nothing, it won't sag. No.
Okay. So
in fact, it will look better.
Okay, will upper maxilla will also be involved in the surgery?
No.
And I am planning to get temple fillers also done later.
You will not need after we do this.
Okay.
And if you want temple fillers, you can put it here. Fillers we have. There one other doctor will come and put easily. But I don't think it's a good idea. Temple fillers, you will put it will disappear. And you will not need it after this, trust me. You will not need any temple fillers.
Yeah, I know this question is kind of weird, but is there any possibility of mortality or something? Because it is a major surgery.
So 1 in a million. We've not had any mortality here so far by God's grace and by our efforts and by making sure safety is our first priority. But technically, yes, you can, right? Like on a flight when you take off, There's also technically feasibility that it doesn't land. This is always there with the surgery. Yeah, but it's very, very minuscule risk. Less risk. There's less risk than probably the risk you took to travel here, something like that. Huh.
And do you take measurements during the surgery?
Yes. Before also, more than during. Measurements are taken before. So what we have, all the kits, if you see, I don't know, we have all the things on the table itself. You can't do these without measurements. It's very precise, millimeter precise measurements. Even if you look at my videos, everything will be 8 mm, 6 mm like that. It will be clear measurements. Otherwise, you'll damage the nerve and create issues.
Main dreaded complication was nerve injury. The facial nerve and
nothing should happen. Don't worry.
Also, I think the parotid gland extends downwards. No? So
inside.
If
parotid gland is going to extend inside. It will be safe. No. Nothing will happen to your parotid.
And if we remove the zygoma, if we slim it down, then there will be a risk of fractures later.
So it will be just little bit weaker than before. I'm not saying there's going to be risk of fracture, but it will be little bit weaker than before. So if you get punched, maybe it can. Well, that can happen even if you don't have a surgery done.
Okay, so will screws be a better?
No, they won't be. I won't be putting screws there.
And when we do the surgery, then is there any unevenness on the surface if we just sculpt over the zygoma?
You have to do it properly, otherwise you can get unevenness.
Yeah, because in some videos, not here, but in different countries, I have seen that people are complaining that they can see that the surface is irregular.
Yes, you have to be careful.
And is there any pain? One more issue I had. On opening my mouth, I hear a clicking sound.
That will remain.
So this, there is some disc prolapse or something. So can it be done during the surgery?
No. We will not do anything to the joint. We let the joint remain the way it is. That clicking will be there. It's not a worry. Don't worry about the clicking.
For after how many months can we take the normal diet?
3 weeks, 4 weeks, 3 weeks, I think.
And working in all.
What type of work? Like seeing patients?
Going to hospitals only.
3 weeks, 2 weeks.
1 month.
Sure, before 1 month.
And
speech alteration initially, few days, then it'll be normal.
And there is a
total swelling will subside in your case maybe in 3 months.
3 months.
It'll take longer because we've got a lot of bony work here and everywhere.
So the major visible swelling.
1 month, 3 weeks. But for it to really look nicer, like 3 to 6 months.
And are there any activities which
swimming,
which have to be avoided?
Exercises, vigorous exercises.
Running, everything.
You should restrict it.
And is there any specific posture for sleeping?
This way is better initially. After that, after a week or so, you can sleep on the sides also.
And after the surgery, do I need to buy a spirometer kind of thing for
No.
running exercise?
No. Done. I cleared the exam with your answer paper. All right.
I just wrote it because
I know it's easier.
After getting out,
they will like, I forgot this. This is better for me as well. I'm happy that you got everything done. So we just finished with all of your questions. And if there are more questions that are arising, we can again meet before we actually do your surgery. Okay?
So, can we have the surgery tomorrow? Because counseling will start any time, and then I have to report to the college which I'm allotted. So I need to get it done soon.
All right. I'll let you know that in a while. Now, I've written the 3 procedures. So it'll be genioplasty and jaw sculpting, bilateral angle osteoplasty, and bilateral cheek contouring. These are the procedures that you'll need. How many millimeters are we going to do? I will let you know that once I mark and everything. I think you've already taken the scan, but I have not gone through it still in detail. I will before surgery. And then you will know, but it's going to be roughly like what you showed me on your iPad. Roughly, it's going to be better than that. All right, and the logic is this. When you remove bone from here, and when you remove muscle from here, when you remove bone from here, and then everything is re-draped by moving these bone also. So you don't have anything loose hanging skin. That's not going to be. So it's all going to get nice and rigid. You staying with us for how long? Like a week?
Maybe 6-7 days.
Yeah. At least 5-6 days is a must. After that, if you want, you can leave and then take care of yourself there.
The sutures are cut or they are absorbable?
No, they're all absorbable. Yeah. All just go away on their own. Done?
Yes.
Okay. So, Rijo, we will try to do for you tomorrow, but what we need you to do before that is to talk to our executive, because now we clearly know the procedures. Whether it's 5 millimeters, 8 millimeters or 3 millimeters, the costing is the same. So he will give you the costing, and then you can get the bloods and everything done.
He said that for you will do everything.
Exactly.
2.5 lakhs.
But this is something I can't see. I gave some rough idea, but let him go through it.
Okay.
Because I think we probably didn't mention all the procedures also on the video call. Did we do the cheek thing on the video call?
Yeah,
I told you.
I have this thing written also.
Show me. But you talk to him first. Okay. Listen, for people who are willing for videos, and also because you're a medical professional, there is some discount, so he will do that. Huh? What's that?